Well, there's no doubt this past year has been a challenging one for everyone, and those facing the challenge head on were healthcare workers. I'm joined now by a panel of doctors across the country to help us look back at what we've learned this year and look ahead to what's left in the fight against COVID-19. Dr. Lisa Bryski is a retired emergency room physician from Winnipeg who returned to practice during this pandemic. Dr. Nahid Dosani is a palliative care physician and health justice activist from Toronto. And Dr. Lisa Barrett, an infectious disease doctor from Halifax. Thanks, everyone, for taking the time to be with us on this a bit of a somber anniversary when we think back on everything that has been lost, lives, livelihood. I want to start with you, Dr. Bryski. You're in Winnipeg. You're retired. When did you decide to come back into practice, and why, and what was that like?
It was a very brief retirement to start with. I was headed out in December, and in third week in January, I saw a very odd picture of a man being taken out of the airport in Wuhan in a plexiglass box as they were describing this virus. And that afternoon, I went back to say hi to people. You know, I've only been away for 3 weeks, but I think it's going to be a very different year. So I was back in by May giving summer relief, spring, summer, fall relief, and I'm back off the line again. During that time, I have a lung concern myself, so I was providing relief for people so that they could do the bigger shifts, providing summer breaks for them. My colleagues were doing the heavy lifting of all this, and I'm proud of them and extremely honored that I was able to help in that small way while they did the big work.
Dr. Dosani, you work in palliative care and with many vulnerable populations who are some of the hardest hit. Talk to us about, what you think the biggest issue this pandemic exposed, because these weren't new issues, but rather they were kind of shining a light on things in our communities.
I think you've said it really well. The COVID-19 pandemic didn't just highlight inequities, it also perpetuated them. And we may have all weathered the same storm, but we were certainly not in the same boat. Some of us were in yachts thriving, and others were in rafts, barely surviving. We saw devastating outcomes for racialized communities in cities like Toronto, where 80% of people who were testing positive were racialized, and we didn't even have the data at the beginning to tell us that story. We had to fight for that data. People experiencing homelessness on the streets, more people than ever before, dying at rates that were 5 times higher than the average Canadian baseline population. And then thinking about people who live in long-term care, the tragedy that we saw coast to coast, and the multiple intersecting injustices that exist there, with staff that are mostly racialized women who are not paid appropriately, don't have decent wages, paid sick leave. The list really goes on. We have a lot to dissect when it comes to the injustices that we saw during COVID-19 in Canada.
Dr. Barrett, you're in Halifax, and we look to Atlantic Canada as a bit of a success story. What did the Maritimes do right in this past year?
Well, the Maritimes had a whole bunch of people who invested early on as populations, and that was not fortuitous, and it was not by luck, and it was not just because we were veritable islands. We had some policy folks who made early, sharp, and decisive decisions and kept making them. But then, at least in some domains of our pandemic response, we worked very hard to engage people, and by that we, I mean the royal we, in actually being a part of the response and not just being people that things were done to where they were asked to do things. They weren't just asked to get tested, they were part of the testing, and everyone was thanked for that. In places where we didn't have great success in the beginning, for example, in some of our long-term care facilities, we made rapid and very decisive changes that are ongoing and invested greatly in research there to make that better along the way. So I think rapid buy-in, decisive decision-making, sticking with numbers and guidance when it was possible and not heading towards the P and the E, the politics and the economics to make decisions, learning quickly and investing in research have been key and core parts, but really no one deserves more credit than Atlantic Canadians.
Dr. Brisky, we heard from Dr. Dasani some of the gaps that this pandemic exposed. We're 1 year in, it's not over yet, there's still more to go. Where are the areas where we can still do better?
We need to continue to keep watch on our long-term care that we have for our elderly. We have decisively said that all Canadians are valuable and we will not have any ageism. So having something that has a standard across the Canada for this particular place, I think would be very strongly recommended at this point. And we are working towards that. As well, within Manitoba specifically, I know from our point of view, having communities that are farther from tertiary care, where if they are extremely sick, the traveling to get to that has shown that communities are vulnerable the greater distance, and this includes First Nations communities. So we need to increase the access to care right within the community for preventative, for keeping watch if something is having a potential to turn for the worse, so that we have somebody that's moved out quickly. Manitoba tackled some of these problems by sending in our military to help deliver healthcare when there looked like there were surges happening, and that's been successful. But we need to keep the eye on these people's health because everyone is valuable, near and far.
I want to talk about vaccines. We just heard U.S. President Joe Biden addressing the nation there, and part of that was talking about vaccine rollout. They've set these timelines for May 1st to have everyone be eligible. He says he wants everyone to be able to be with their families by July 4th. How are you feeling, Dr. Dasani, about where Canada is on the vaccine rollout? We had a number of delays. Now we've got 4 vaccines in play, but getting them into arms is another story. How are you feeling about where things are at?
You know, it's been a disappointing rollout for Canadians coast to coast. We're not seeing the number of Canadians we'd like to be vaccinated up to that optimal state. We're certainly behind from a proportional perspective to our neighbors down south. But, you know, there was a lot of focus on supply of vaccines, and we now have 4 approved vaccines, which is great. But it's one thing to have the supply, and it's another thing to win over the hearts and minds of people to get the jab. And I'm talking about addressing a concept called vaccine hesitancy. And for many communities, including communities who have experienced trauma at the hands of government, at the hands of institution, or at the hands of healthcare, vaccine hesitancy is very real. It's often described as a mistrust of the healthcare system. And what we need to do is convert that feeling of mistrust into trustworthiness. And that means connecting with communities so that they do trust us, investing in racialized communities, investing in leaders who have those relationships, being compassionate, being clear, being creative, and being really community-minded, really decentralizing our approach to vaccine information. If we don't get trust in our communities, we won't get the uptake anyway. So we can't just focus on supply. We need to address vaccine hesitancy.
Dr. Barrett, are you hopeful that Canada will be able to catch up in this vaccine race and getting the vaccine into the arms of as many Canadians as soon as possible?
You ask a loaded question because just to agree, we do have a ton of supply at the moment. And it's this, we throw around these words of engagement and connecting and relationships. There are many provinces in Canada where we haven't done that well, almost none at the level we need to. There are an incredible number of people out there who want to be a part of the COVID effort. And we've described in different provinces, including some of the Atlantic provinces, that this is a bit of a wartime effort in some ways, similar to the way President Biden has. And I must say, if we don't start taking advantage of the help that Canadians want to provide, getting rid of bureaucracy, being very specific about providing community-centered care, and by that I mean letting them tell us what they need for vaccines, demedicalizing things, we're going to struggle. And that would be a crying shame because we know that it works. We've done it with testing in parts of Atlantic Canada. We have to start not talking about it, but doing it across Canada. And we are culpable if we don't make that happen and demand it as a population and a public We should demand that, and we should demand it now.
Dr. Brisky, before we go, what is the message in your mind, both to the public and to officials as we head into the summer? You know, people are dealing with, pandemic fatigue. What's the message in terms of making sure that we don't let up just yet?
Keep connected with each other. We have had challenges in this area, obviously, and we've had to turn to virtual as well as outside. Summer is coming. We're going to have more chances to stay connected in the outdoors, but keep connected and keep informed. As you know, from the beginning of this pandemic, we said to begin with that there's going to be new information coming in all the time. Even today, we've seen new information coming on vaccines and how Europe has had some concerns. We need to keep our information ear to this to make sure that we are up to date, so that when it is our turn to do something to help our community, that we're knowledgeable about it and can do an effective job of it.
Dr. Lisa Brisky in Winnipeg, Dr. Naheed Dosani in Toronto, and Dr. Lisa Barrett in Halifax. Thank you all for taking the time to be with us, and thank you for your important work.
Thank you so much. Have a good night.